Hello and welcome to all of our GOLD viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at GOLD Midwifery. And I have a special guest with me here today, Loredana Zordan. Welcome, Loredana.
You're very nice to be here to all
It's
these lovely
wonderful
people.
to have you here. You are going to speak at our GOLD Midwifery Online Conference. I'm very excited about it. And your topic is going to be acupressure for pregnancy and birth. But before we jump into this, tell us a little bit about yourself, Loredana, where in the world you are, and a bit about your background as well.
Yes, I'm a midwife. I used to work in England as a midwife. I've done a lot of community midwife. And after that, I'm very interested about Chinese medicine, and I start to learn it. I became an acupuncturist, specific related to midwifery acupuncture. I did a training in England of obstetric acupuncture. Yes, it's my interest started about acupressure because I started work with Deborah Bass, and I believe that acupressure has got a lot to offer to midwifery, particularly because it will empower not only midwife but women as well. They can have a positive experience, and definitely I believe that acupressure and moxibustion reduce the medicalization of childbirth, keep things normal within the physiology. That is my interest, basically.
Beautiful. Thank you so much for sharing that. Yeah, so Chinese medicine, you were first a midwife, and then you became interested in that. Now, let me ask you this. What is the difference between acupressure and acupuncture, besides that acupuncture uses needles and acupressure doesn't? Is there any other differences in, would you say that acupuncture is more potent or you know, stronger than acupressure? Explain that to us a little bit so we know what the difference is.
Yes, I believe they come from the same principle, because basically the acupressure, the point you use in acupressure, the same point you use with acupuncture, with the acupuncture point in acupuncture. Obviously, I think that is more practical, is easy to use acupressure for instance, for pain relief in labor. I believe that acupressure is more effective than acupuncture because women can move around and they can, you know, the partner can help the woman to use acupuncture. And so basically, I think there is a big advantage by using acupressure, particularly for pain relief in labor. And midwife can really use it.
That's wonderful. Yeah, so you don't need tools. Also, some people might be afraid of needles, right? So they're worried that the needles will hurt from acupuncture. So acupressure is perfect for that, and you don't need any tools. You could just use your hands doing that. Correct?
Yes, I think it's very easy. You don't have to have a lot of knowledge about anatomy, for instance, because when you use, I'm an acupuncturist as well, but I think that with acupuncture you need to be very precise about the point, and always you need to rely on other people. You know, need to have an acupuncturist with you. However, with acupressure, I believe, and there's been some research as well, that it seems to empower women, because women can do something for their health.
Yeah.
In a particular moment where this, you know, birth, which is very sort of, you know.
And some points, correct me if I'm wrong, could be trained to do, the person could do on themselves, right? Maybe a pressure point on the hand, or
Yes.
I mean, if you're pregnant, it's hard to reach your feet, but maybe some areas, maybe if they feel like there's nobody there who's trained, maybe they could do just some points themselves, or have their partner do it when they know, or their doula do it when they know where these points are. Is that correct?
Yeah, it's correct. I think it's just that they can actually use it themselves, you know.
That's perfect.
I think is empowering, yes, as well. And I believe that this makes like, for instance, I strongly believe in Chinese medicine in a way that mind and body is related together. Okay, so using acupressure point, if at some point are really calming, it's obvious the more relaxed you are, you might increase the oxytocin as well. The more relaxed you are, the more you go better with the pain.
Absolutely true. Yeah. And you're so right. We are not the connection between mind and body. It's so important, especially when we're looking at labor and childbirth, right? Being relaxed is helpful in labor, and having also a relaxing environment and a calm and good environment and caring people there at labor and during labor, and maybe also having the midwife be able to do these pressure points, or the doula or the woman themselves or the birthing person themselves. So absolutely, it sounds beautiful. And you are training midwives, right? You're doing it on
Yes.
workshops as well. So you have a website we can reach you at?
Yes, there's the website. Yes, it's www.loredanazordan.com. Yes, I've been teaching for the last 10 years in Italy. And since I started teaching acupressure, a lot of hospitals were using it. And then I'm not only teaching in Italy, I used to teach in England, and there is actually one hospital that they're starting to use the guideline of acupressure, so they're actually implementing to use it.
Oh,
I've been
beautiful.
teaching in Malta, I've been teaching in Greece. It's always midwife. I believe that I like what I'm doing, obviously, because I believe that it can help changing things,
And and beautiful that you're bringing this into also hospitals, not just like birth centers and that are already holistically minded, but also hospitals that are more medically oriented, obviously, right? That they are now implementing these these guidelines that you brought
Yeah,
to them. That's
especially having a
fantastic.
guideline will help. I mean, my suggestion is that it's not necessary that you must have a guideline. What I usually say to the midwife that coming to my training is that I really encourage them to use it, because as long as they got a woman permission to use it, and as long as they know the point that they need to avoid, because they're point for induced labor, is a safe technique. Obviously, having the guideline will help them to make the changes quicker, because all the hospital will adhere to the guideline. But really, this is just encouraging using even without the guideline, basically, because as I say, I repeat myself, it's a safe technique.
It's a safe technique. That's wonderful to have that. And you told us also that you are writing a book that's going to be published very soon, first in Italian and then in English.
Yeah.
Tell us about that one.
The book has been, it's just like, I'm very excited about it, obviously, because I've been working for the last 3 years. And the book is not only for midwife, but it's for women as well. So I try to write in a way, or pattern of people, doula for all that want to be involved with birth process. What I try to be seen, because Chinese medicine is not easy in a way, because it's not that it's difficult, but it's just it's got a different approach from the traditional medicine. So I'll try to write this book in a way to explain a little bit about the theory of Chinese medicine, and I try to be practical, more the use about acupressure. There's going to be a lot of picture of that I've taken, and what I really like, I'm very proud of it. There's going to be a lot of testimonial about women I've been treated, and of midwife that I've been taught to. So I'm really hope that it's going to be good for for changing thing, introduce acupressure to everybody, basically. And there is a little bit about moxibustion, which I strongly moxibustion for turning the breech. So it's not only about acupressure, it's about moxibustion as well. And I will cover all the antenatal problem, preparation of labor, induction of labor, and there is a paragraph about postnatal care as well. So I try to be quite complete.
Complete. That is fantastic. That sounds wonderful. Yes. And your presentation here at GOLD, the presentation Acupressure for Pregnancy and Birth. What I like about this, we went over that a little bit. I got a little sneak peek. You will have videos in there. You will have pictures. So you go through quite a lot of information there for our viewers who can view the presentation and learn and implement some of these techniques that you are showcasing in the presentation. Correct?
Yeah, and as well, I try to put on my presentation some evidence base.
Good. Yes. Yes.
Although I strongly believe that is not everything can be proved in in acupressure, because it's not being used a lot and things, but there are some evidence which, they are very positive. Seem the most important thing, I believe, that is seem done some study that seem to reduce the medicalization of childbirth. There's going to be less use of epidural, less use of cesarean section. So definitely, I believe this is very important. So I'll always like to be some evidence as well.
Perfect. Thank you so much, Loredana. It's been a pleasure sitting down here with you and chatting. It's been wonderful. I can't wait for your presentation, and I'll learn from you about acupressure for pregnancy and birth. Thank you so much.
Okay, thank you. It's been a pleasure. Ciao, ciao.
And to our viewers now, if you would like to find out more about this presentation and all the other presentation in our Gold Midwifery Online Conference that we kick off February 6th here with our Open Access keynote presentation, go to goldmidwifery.com. You will find information about all the presentations and also how you can sign up for the free keynote. It's open access, as I mentioned, and we hope to see you at the conference, everyone. Hope to see you there. Bye, everyone.
Okay.